Well, how everyone, it's Pete here from the Pain Toolkit. Hey, listen, we're back. Had a little week and a little so off, and got my good buddy with me today, Dave Oxley, who's joining us on the Pain Toolkit Academy. Hey, listen, and who have we got below, Dave? And that's our good friend, Dr. Sue Peacock. So, how are you today?
Yeah, I'm good, thanks. Nice to see you both.
Yeah, well, it's good to see you, Sue, and thanks very much for coming along to do the Pain Toolkit Academy Q&A. Had massive feedback. A lot of people been sending in questions, etc. We chosen, well, not chosen four. We just took the first four and kept the others for another day.
Yeah,
But just before we start, can you just very briefly, well, listen, the viewers and listeners know about us two brothers, like, and Keith, by the way, is still on his vacation. He'll be back soon. But can you just give the viewers and listeners a little bit of a very brief overview of who you are, what you do, etc.?
yeah, that's great. Thank you. Thank you for inviting me today. That's really kind. So thank you. So yeah, I'm Dr. Sue Peacock. I'm a consultant health psychologist. I've been working with people with chronic pain for all of my career, which is over 25 years now. So I've known you a long time.
Yeah.
And now I've worked in the NHS for about 20 odd years in a pain clinic, and for the last 7 or 8 years, I've been in independent practice.
Mm.
Use a whole variety of techniques. So, good old CBT, that kind of stuff, acceptance and commitment therapy, EMDR, which is eye movement desensitization and processing, and also hypnosis. So I've got a whole sort of toolkit of techniques that we can use to help people improve their pain and more importantly, improve the well-being and get them to get on with their lives despite the pain and have a really good quality of life despite that.
And that's why we love you, baby. You're one of us.
Well, it's important, isn't it?
Okay, let's go on to question one. This is from a healthcare professional called Joan. And she says, can you explain how psychological factors can influence the experience of pain and how this insight benefits multidisciplinary pain management?
Okay, yeah, that's a good question, isn't it? Absolutely, because I think it's really important to think about psychological factors because pain isn't just that sort of sensory experience, is it? It's not just nerves traveling to the brain. It's also sort of an emotional and a cognitive experience. So factors can kind of intensify, reduce, or even maintain the pain. So, if we think about attention and focus, for example, if we pay close attention to our pain, it makes it worse, where distraction can lessen it. If we think about the emotional component, the anxiety, the depression, the stress, that all kind of amplifies that pain perception by amplifying the brain's kind of threat response. Whereas in conversely to that, positive mood relaxation can reduce the pain intensity. It's about expectations and beliefs, isn't it? What people believe will happen often happens. For example, if you're expecting a treatment to work, quite often it works or lessens the pain. And then there's the important things, isn't it, that we focus on quite a lot, and especially your fabulous toolkit. It's about coping strategies, isn't it? Pain management strategies, those active coping strategies like pacing and problem solving. Whereas if people are feeling sort of avoidant or helpless, that reinforces those chronic pain cycles, doesn't it?
Mm.
And then there's that sort of social and cultural context, because we know that supportive relationships can help buffer the pain. So I think it's really important for having that sort of biopsychosocial approach, isn't it? And integrating those medical, psychological, and social factors, which I do think is really forgotten about sometimes, which is why your cafe is really good, isn't it? Because it gives that support to people and support groups are out there.
Yeah.
I think if we think about the sort of the multidisciplinary type of approach, it gives a comprehensive care, doesn't it? It improves outcomes, it empowers people, gives them self-management skills, ultimately reducing healthcare costs. And if we can get in early, then often it prevents that chronicity of the pain.
Mm. It's funny, I've been using it on recent slides. It was a quote from the International Association for Study of Pain about where does pain management start?
Yeah.
They're talking about it starting before primary care, like, there's one of the famous sort of quotes that they put up there, and it's on one of their pages, like, and I saw it and I thought, wow, this is this is unusual.
Mm,
So it's like about where it stood in the ladder, like, in the pain management ladder, and
yeah.
they're talking about people helping themselves prior to primary care, sort of thing, like, how that's going to work. I'm not sure, but um, I was quite interested. Dave, can I ask you? I mean, we've talked about this quite a bit, like with psychological stuff. Our pain has an effect on us, like, low mood and whatnot.
Mm.
I was about you, Dave. I mean, because you went on a pain management in the early days, didn't you? Was there a psychologist involved?
Yes, there was. Yeah, there was a psychologist on the NHS one.
Yeah.
But as I said on a previous recording, my head wasn't in the right space for it. So I didn't get as much out of the course as I could have done.
Mm.
So that's why I was really excited to have Sue come along today because, trying to learn whilst I'm coaching others how to start to get them in that right mindset if they're not there yet.
Mhm.
So how do without giving away your trade secrets as from your practice, but yeah, have you got any tips on how to get people to start thinking that self-management and being a bit more positive and giving things a go might be, a good way for them to start taking control back of their life?
Yeah, I think what I try and do, whether it's right or wrong, I don't know, but it, it, it works for me. But I think it's about finding where they are, finding something that they've got a passion about, or they're interested in, and saying about small steps, because small steps are really important, aren't they? We don't want
Hmm.
giant leaps because they're not sustainable. But if we do it in sort of that pacing approach to everything, even small things, then it kind of builds confidence, doesn't it? And you think, okay, well, I can do that, and my pain didn't get worse, so maybe I could try a little bit more then. So it's a kind of about building and nurturing trust in themselves, trusting their body that they can do things,
Hmm.
and believing in themselves, and kind of trying to get rid of the feelings of guilt and shame and all of that kind of stuff that kind of get associated with it. I think it's about getting them to communicate with partners, because I think that's really, and families, because I think that's massive, because they're with healthcare professionals like me, an hour or whatever, and they've got their whole lives out there, haven't they? And
Hmm.
as I'm not going to be calling them up every day saying, "Are you all right? How's it going?" kind of thing, because it's about them having the confidence to do the things that they want to be doing. Yeah.
Yeah.
Okay, thank you.
Thank you.
We're going to go on to question two, which is from another healthcare professional, someone called Harry. And Harry asked, what strategies do you recommend for healthcare providers to incorporate psychological support into the treatment plans for patients living with persistent pain?
Okay. Well, I kind of there's two sorts of things to that, isn't there? There's kind of the self-management strategies that we can teach, such as the relaxation, the breathing exercises. So even gentle breathing, progressive muscular relaxation, guided imagery, all that kind of stuff that can calm the nervous system. Um, there's sort of that mindful awareness, so the mindfulness stuff, which kind of lowers frustration and anxiety and things like that. And there's lots of apps and things out there that are quite useful as a starting point. I think one of the key things is that activity pacing, isn't it? Talk about that boom and bust cycle, because that's just critical, isn't it, to manage
Mhm.
pain? Absolutely. So you don't do too much on the good days, and you're not crashing on the bad days, because that just gets you frustrated and cross and stuck in that pain cycle, doesn't it?
Mm.
I think journaling can be quite a good thing. writing about your emotions and triggers and things that have helped you manage your pain. I think that can be helpful.
Mm.
Not convinced about pain diaries myself because
No.
I think, you could be having a really nice afternoon watching your favourite film with your kids or whatever, and then you think, oh, it's 4 o'clock, what am I doing? I've got to rate my pain. So
Yeah.
I'm not a big fan of those kind of things.
Me neither.
No.
So, in fact, I think in the early days, I think that was the way your pain diary, track your pain and everything. I remember years, I don't know how many years ago. It feels like only a couple of years ago, but I think it's more than that. But clinical psychologist Patrick Hill,
Yeah.
so he said to me, "We don't really do that anymore, Pete. It's because what's happening here is the person's focusing on their pain, rather than it's about moving on, sort of thing, And it's like navel gazing, I suppose, for want of a better expression, really.
No, I agree with you. And I think, also getting that sort of connection support from other people, whether it's support
Yeah,
with family, friends, and all that kind of stuff. And then, there's sort of therapeutic techniques, isn't there? So there's, CBT, acceptance and commitment therapy, hypnosis, guided imagery, and all those sort of mind body approaches like yoga, Tai Chi, all that sort of thing. So all of those things, I think, are good strategies that we could start to talk about with our patients, clients. Yeah.
yeah. Okay. Anything to add to anything to that, Dave?
No, just glad that pain diaries are becoming a thing of the past because I remember filling one in for a couple of years. And yeah, you're right, Sue. I was just concentrating on how bad the pain was rather than what I'd achieved and how I was progressing.
Yeah, yeah. I tend to, if people like that kind of thing, I'd probably do activity diaries. What are you doing? What's
Yeah,
rather than what's the pain like? Because that's more useful, isn't it?
yeah, that's what mine evolved into in the end. And I just dropped I still had the pain columns, but I just never filled them in.
And it's about finding, as we said, it's about finding the right approach for the person that's sitting in front of you,
Mhm.
isn't it?
Yeah.
Absolutely.
Yeah.
It's about moving on all the time, isn't it? I think
Yeah,
nothing personal, Sue, but some of your colleagues out there, perhaps, but we have to remember a lot of healthcare professionals are out there haven't. It's not their fault, but they've never been exposed to pain self-management, etc. They've been
yeah, absolutely.
taught in their respective medical schools, pain management, mainly about meds or, well, if that doesn't work, you move on to something else, blah, blah, blah. But actually, when it comes to pain self-management or just self-management, it's never on the agenda, sort of thing. But so I'm not blame in a blame game, but you can't teach what they don't, what they're not being taught. So
Yeah, yeah. So that's why it's good that you're doing these kind of things, isn't it, to get more people and more awareness out there.
yeah, but that's why we started up the academy, really. When it Dave, a couple of year or two ago, to help healthcare professionals get some sort of basic knowledge on how to get in, how to get involved with pain self-management, etc. And I think we launched that
Was it May last year?
last year, early part of last year, and then
It was May because we did it just after a bank holiday.
so launched that last May, yeah, 2024.
Yeah.
This year we launched or the early part of this year we launched the patient version. What the idea behind that is so that both the courses sort of mirror themselves. So if the healthcare professional goes on and does uh, registers for the healthcare professional one, then they can signpost the patients to the patient version, and
Yeah,
then in a way, there's both singing from the same hymn sheet,
yeah, it's perfect like that, isn't it? Absolutely. Because
We just keep it very, very simple, very practical. Both are very affordable, etc. But anyway, we're going off script here a little bit, but as usual. Uh, Number three, doing really good as well. Well done, everyone. Pain Self Manager Garry he asked for people dealing with persistent pain. what self-management strategies or therapeutic techniques do you find are most effective in managing their emotional response to pain? Now, to me, a lot of the emails that I get from people, so when I say emotional, they're either massively upset. I'm not going to say angry, but frustrated
Mm.
that they're being put in a position they don't want to be.
Yeah.
They're sort of trying to get out of this, as I call it, get themselves back on track, back into their driving seat,
Mm.
and they're just frustrated. They just, because when I say to them, well, what have you been told about getting yourself back on, what's your plan? I also try and keep it in language they would understand it. Well, what have you discussed with your healthcare professional? What is your battle plan for moving on, getting back to doing things that you've been unable to do, or even doing new things, etc. And they reply saying, well, "What do you mean? No one's talked to me ever about that." So it's they get upset, and I'm not trying to make you upset. It's just these are the things that we need. But as I had to, because I've been where they are, because I was getting frustrated. Hell, why wasn't I had to find a pain management program off my own bat. I was never signposted to it by anyone. So through my own frustrations, I suppose, I thought well, there had to be something else other than something out there that could get me back on track, other than pills and hanging around, sitting at home like.
Yeah. So are you asking me sort of about sort of communicating your psychological needs kind of thing? So what do people how to say what it is you want from a psychological point of view?
Yeah, I mean, well, it's like Gary, he says, what's therapeutic, or what's, about self-management strategies like, I mean, what sort of, when, I suppose the question I always ask healthcare, or I get asked by healthcare professionals, when should I talk to them about self-management?
Walk through the door.
I laugh a little bit. I say, well, you know, one of my catchphrases is pain self-management your first choice, the last result. And it all seems to be that, that's been offered to them as a last result. And I often wonder, why didn't you talk about this from the get-go, like?
Yeah, absolutely. I think it's one of those things, isn't it? I think because for so long pain's just been perceived as a physical thing, doesn't it? And rather than people seeing sort of the impact, pain's almost like the pebble in the pond, isn't it? And it's the ripples often that are affecting everything else that make it hard to live with. It's often the impact of pain, isn't it, than rather than the actual pain that's hard to live with. So I think it's important to be open about that emotional impact, let people know how the pain's affecting your mood or your sleep or your relationships or even your confidence, because it does take a dive quite often, doesn't it?
Mm.
It's about thinking about discussing those sort of stress triggers and coping patterns, share what's making the pain worse, what makes it better, because
Mm.
it's always important, I think, to balance that question, isn't it? What makes it better? Because there's usually something that doesn't necessarily take it away, but makes it a bit better. And so it's about finding out things like that, isn't it? Sometimes it's even asking directly for support. It's because it's okay to request psychology as part of your care. That's you could say something like don't refer. I'm not saying ask to be referred to psychology, but can we look at ways to manage the stress and emotions around my pain as well as the physical side of things. Um, and it's about sharing what's important to you, what matters. Is it that you want better sleep? Is it that you want to return to your hobbies? Is it that you want to be less anxious? You know, it's about what's important to you as a person, isn't it? Not about the pain necessarily. It's about what's important to you as a person, and try and get that support network. Be it going to healthcare professionals, to be fair, vary, don't they? Some of them are more supportive than others. Will be a time factor. probably an interest factor. I don't know, but seek out people like you that do the pain toolkit. Seek out local support groups, but not those dreadful moan groups that turn into competitions because they're not helpful.
Young Calauba groups, I call them. But the yeah, I mean, Dave, what's your thoughts on this? Have you got any comment on this?
Yeah, it's a good point you raised earlier about, is it anger or is it frustration? I think it's probably both. I think the people reaching out to the pain toolkit are angry because they're effectively going through the grief process. So, yeah, one thing I've found helpful coaching people is talking about the grief process and saying that, they're effectively, well, I know I was mourning the life I had. I was mourning the body I had. I was mourning what I used to be able to do versus what I could do at that point in time. So, letting people know that it's okay to be upset about, your condition, but and then going back to what Sue said in answer to the first question, it's right. So now that we know you're upset about it, what are we going to do to start to get the little wins, start to build that momentum? You're the snowball at the top of the mountain, and we've got to get that momentum going so that we can cause the avalanche. So it's changing it from yes, I know you're angry to how do we start getting you to do something positive?
Yeah, absolutely. Sometimes it's even giving people space, isn't it, to hear their journey, kind of
Yeah,
where sometimes they don't get that, do they? They just get, their X amount of minutes with the healthcare professional,
yeah.
and they feel rushed, and there's oh, you can only talk about one thing when you're in here, kind of thing, and lots of different things matter, don't they? It's not just one thing with pain, is it? It's different.
Something Pete mentions on most of these is two ears, one mouth. As the person helping or supporting the person with pain, you need to listen a heck of a lot more than you talk, especially at the beginning, so that, as you say, Sue, they can get their story heard.
So can I ask you a quick question? I know I always remember when I was on my pain management program, and I don't know why they never I'm not talking about the people running it. It was the couple of the dudes that were on the course with me. Like it's quite a large group, 18 I think, but they split us into two groups of 9. But when they said, "Oh, your next session that will be with a clinical psychologist," and they thought, "Well, hang on a minute, what do you think? I'm bloody crackers or something, you know?" And and I didn't say anything like, because I was there for myself, like, but I could see, 'cause they say, well, that ain't gonna work for me, and I'm thinking, well, mate, for me personally, I thought I was going crackers, like, I was getting a lot of emotion and anger and why me and stuff like that. I mean, do you find that when people come to you like they're saying, I don't know why I'm here, why I've been referred here, I'm not crackers, I've got no, I've got pain. I mean, how do you deal with that sort of stuff?
I think it's about. I do get lots of those people. I don't get quite as many now. I'm in private practice, but
Uh,
definitely when I was in the NHS, and I think people that there's different categories of people, isn't there? There's some people who genuinely want help and come, which is great, and it makes my job much easier. There's people who are sent to me and come because they think they should, and because they've been told to come. And then there's people that don't really want to be there at all, but they think, oh, okay, I've done what I have to do, I might as well come. And I think there's always that stigma, isn't it, that, or we don't, because somebody's probably down the line, it's a bit of an old-fashioned thing to say, but some people still say, well, it's all in your head. And
yeah.
that's just so not helpful, is it? Because a lot of sometimes for the first session, for me to kind of build trust, build rapport, explain that pain is influenced both the body and mind, and it doesn't mean that it's all in their head. We have to use like metaphors, like turning up the volume or turning down the volume of the nervous system and all that kind of stuff,
Mm.
and trying to explain that our mind and body are connected. So, for example, if we feel awkward or embarrassed or whatever, we might go red. And that's not because we're thinking about going red, it's because it's a response that happens. And so we have to kind of learn to turn that down a bit. So a bit like pain, an emotion will evoke, or a feeling will evoke a response, a physiological response. So we have to try and talk about that mind-body connection. And once we kind of get that over, it's the
Yeah.
journey. Yeah.
And do you find that younger people are more accepting of coming to see a psychologist for their pain than the older generation? Just thinking about how society's changed, my kids and how they approach things versus how I approach things at their age it's like chalk and cheese now.
It is, absolutely. I think younger people, I think because the message of mental health, like to be ashamed about, it's not a stigma, all of that kind of stuff is slowly filtering through. I think people are a little bit more mindful about mind body approaches and things like that. So I think younger people are probably a little bit more open than when I first started my career all those years ago. And because society changes, there's different ways of getting messages across now, isn't there? And
Yeah.
it's not seen as taboo anymore, is it? It's a legitimate thing that happens to people, and they need help. Yeah.
Yeah.
Okay, last but not least, one other fun question, we like to call it a fun question at the end. But the last one is from another pain self-manager called Fredericka.
Mm.
And she asked, how can people, so she's a pain self-manager herself, how can people better communicate? I think we've probably touched on that a little bit already. How can people better communicate their psychological needs related to pain to their healthcare team to ensure that they receive the right comprehensive care?
Yeah, I think it's about, as we said, it's about being open and about your emotional needs, isn't it? It's about asking for help directly,
Yeah,
and not being embarrassed about asking. Just ask for it. It's out there. Okay, it's not always easy to find, but it is out there. It doesn't necessarily have to be from a psychologist, does it? It can be from other people who are going through the same sort of thing, like you and Dave. So there's lots of support out there. It's just about being open about it and recognizing perhaps patterns to that are triggers. Again, it's really important to share goals beyond pain relief. Yeah, all of those kind of things.
okay. Right, thanks for that. And the last one is, well, we like it anyway. You've been using it the last 3 or 4. I quite like it actually. So imagine you're hosting.
Mm.
You could host a dinner party with 3 prominent figures in healthcare. Who would you like to invite, and what would you like to discuss regarding self-management?
So you mean apart from you and Dave?
Make on fish chips. Uh,
Well, I would like to. I've spoken to this guy once before, and he's really interesting. He's called Dr. David Siegel, and he is at Stanford University, and he's an expert on hypnosis and self-regulation. And he's done lots of research on how hypnosis can be a really powerful tool for pain, anxiety, and habit change. So with him, I'd like to discuss, incorporating hypnotic techniques into sort of mainstream healthcare for better patient autonomy. So I think he'd be interesting. I think who else? Ooh, Brenny Brown. She's quite cool, isn't she? She, she's called Brenny Brown. She's a researcher on shame and vulnerability and things like that. And I think that's such a big thing for people with chronic illness. They sort of struggle with that shame and blame and identity shifts and things like that. So I think with her, I'd like to discuss how clinicians can create sort of psychological safe spaces for clients or people with pain to take ownership of their health, but without the guilt. Because I think that's really important, because guilt is such a big thing for a lot of people I see. And then I would like to have a chat with Professor Tricia Greenhall, I think she's called. She's a researcher at the University of Oxford. and she's one of those leading voices in patient-centered care, chronic illness, and digital health. So I think it'd be really interesting to talk to her about her research on sort of self-management support for people with long-term health conditions like pain, and we could talk about how clinicians can balance sort of providing guidance but respecting patients' lived experience, because I think that's that, you know, until recently a lot of us didn't really value that patient's lived experience, and actually that's the most important thing about it all, isn't it? But I'd also like to talk to her about whether the digital tools, whether the apps, the wearables, all the online, you know, programs and stuff, you know, do they genuinely help people take control, or you know, are they just additional burdens sometimes?
Mm.
So, you know, I'd like to sort of steer that conversation to maybe rethinking self-management to as more than just educating people. You know, it's you know what you guys do. It's about, you know, empowering patients without overwhelming them, isn't it? It's about that role of psychological flexibility in living well with illness, about how healthcare systems can integrate digital tools, sort of behaviour science, and compassionate communication to better support people,
Mm.
and finding that sweet spot, the balance between sort of patient autonomy and professional guidance. So that would be my dinner party, as long as I didn't have to do the cooking, preferably.
We
Yeah,
cater for you, don't worry, Sue.
they sound like very interesting dudes, actually. I think
Mm.
I wouldn't mind inviting them myself, really. That sound really cool. Hey,
Yeah,
Dr. Sue, it's fantastic. We're on time, actually, and which is probably one of the first, Dave, isn't it?
The first, I don't know about one of.
Yeah, the first. And but thanks very much, Sue. It's nice to see you again. I know that you're going to be one of the presenters in the next conference that we've organised, the on the 18th of October. So we're looking forward to seeing you on that. And if Sue, do you want to tell? I know you've got a website. Can you? Um, as become an older person, my memory's a bit faded. Could you sort of give yourself a bit of a plug, really, of your website, how people can get hold of you?
yeah. If you want to get hold of me, the easiest way is via the website, which is www.apaininthemind.uk. No, .co.uk. Yeah.
And I'll put that on the YouTube link, and also the audio version on SoundCloud. Well, so thanks very much for joining us tonight, and as usual, I thoroughly enjoy you. Hopefully, you come back sometime. You know, we're going to take a break actually from the Q&A for a little bit, and I think once it gets a little bit darker and we'll start hibernating a little bit, we'll kick them off again, like, and I think perhaps when Keith comes back, we can perhaps start them up, or I don't know whenever we get the energy, I suppose. But
Yeah.
if
Love
you
to,
come back and join us again, if you're free.
love to. Thank you both very much for inviting me. It's been
Uh,
great chatting to you as always.
I was just sitting here thinking, like, I don't know about you, Dave, but and I'm saying we're talking about turning these into a podcast. But when I listen to other podcasts from other people, which I'm actually getting into, these Q&A things are actually feel more like that, just like a being in conversation with people, like, and I'm learning so much, like, getting people's opinion.
Hmm.
That's good. It's
Yeah,
good to share things. Yeah, yeah, it's great.
yeah.
Anyway, take care. So have a groovy evening. We'll get seeing you, see you again soon. Myself and Dave will see you in a not too distant future. I'll be on a Q&A, or definitely the conference on the 18th of October. Don't forget, and also what I'll do is I'll put can you, Dave, can you remind me of the theme of the conference?
Yeah, let me just check my notes. It's changing the conversation, people-centered pain self-management.
Okay, great. We've got some great speakers, international speakers, and also we got the British Pain Society and European Pain Federation, who are going to be showcasing what they do, because they're organisations that are like an umbrella to all the healthcare professionals around the UK and Europe, etc. Anyway, so Sue, take care. Have a nice evening, and we'll see everybody soon on another Pain Toolkit Academy Q&A. Take care, everyone. Ciao.
Bye all.
Look after yourselves. Stay safe.